Hi, my name's Wayne. I'm a health trainer in North East Links. I work in the community in the surrounding areas of East Marsh, West Marsh and most of the estates. Certainly I've been around for quite a long while, and I've certainly made some really good friends, some really good contacts. Part of my role is also helping with the health checks. We do these in clinics, in doctors' surgeries, and we work hand in hand with the doctors, nurses. Also, what we do is try and support people with stopping smoking, healthy eating, increasing physical activity, sexual health, reducing stopping smoking, stress, anxiety and men's health. We can be seen about. We all wear either red or black t-shirts. If you want to chat to somebody, just stop us. We'll be quite welcoming, and we can arrange to have an appointment with you on a one-to-one basis. Anything that is said to us is kept in confidence, so you can feel that you can really relay your problems to us or any health issues. My role is to support people with weight loss, healthy eating, lowering the cholesterol, getting back into physical activity, supporting people with maybe men's health or even some mild stress, anxiety. Some of the reasons why people should take up support of the health trainers is for the simple reason that most people know how to eat healthy, to increase their physical activity, but sometimes just being with someone that can explain them how it works, when it works, what's available and what the price is, and trying to motivate them back into a system which probably they haven't done since they were young children at school. Certainly things that do help is by giving support, things like doing a diary, just a diary for healthy eating or increasing your physical activities. When you see it set out at the end of the week, have I really done that amount? It really does count. I support most of the health check service by actually working in the practices. I have my own clinics. In 5 of the 6 that I do, there is a late night clinic, because we do believe that people work and people need to have support later on in the evening. We also can do it by direct referral of the nurses and doctors. But mostly it's about personal contact in the surgery, getting your face known, being well known, being active, being talking. Supporting the stop smoking is by generally giving brief intervention, seeing when people are ready to stop smoking. There's 2 systems that we can use. We're all trained in level 2 stop smoking, which is NRT products. Anybody wishing to go to different things like Champix or need some extra special support or are pregnant, then we will refer them up directly to the specialist stop smoking services. We work hand in hand with the specialist stop smoking services. We can book in direct and get them an appointment. Every encounter counts, so we can move that along very quickly. Yeah, we have numerous outcomes. We deal with a lot of people, maybe 11, 12, maybe 14 people on a session. Not all outcomes are successful, but by planting a seed we hope to change people's lifestyles and the way they look at their lifestyles in the future. Very good success rate actually working in the clinics. Recently I just had a middle-aged man who had an health check in January this year. He was borderline diabetes, his cholesterol was sky high. Unfortunately he wasn't working at the time, smoked quite heavily, and did no physical activity whatsoever. In fact, most of the time he's just sat round his house. By having a chat with him, by going through the portion sizes, by getting him to do physical activity, he didn't want to join any of the services, but decided by giving him a pedometer, have increased his walking space. He walks everywhere now. He was 103 kilos when he started on 31st of January. He's now down to 78 kilos. Fantastic weight loss, just by reducing portions and increasing your physical activities. On the unfortunate side, he still smokes, but not as many.